There are 6 core values of social work that unfold in practice in various ways. These core values are outlined in the NASW Code of Ethics as being service, social justice, dignity and worth of the person, importance of human relationships, integrity, and competence. In regard to service, the NASW Code of Ethics states that social workers' primary goal is to help people in need and to address social problems. Social workers elevate service to others above self-interest. Social workers draw on their knowledge, values, and skills to help people in need and to address social problems. Social workers are encouraged to volunteer some portion of their professional skills with no expectation of significant financial return. The way that this unfolds in practice is that social workers often provide pro bono services, address social problems even if it conflicts with their own personal self-interest, and participate in volunteer work related to social issues. In regard to social justice, the NASW Code of Ethics states that social workers challenge social injustice. Social workers pursue social change, particularly with and on behalf of vulnerable and oppressed individuals and groups of people. Social workers' social change efforts are focused primarily on issues of poverty, unemployment, discrimination, and other forms of social injustice. These activities seek to promote sensitivity to and knowledge about oppression and cultural and ethnic diversity. Social workers strive to ensure access to needed information, services, and resources, equality of opportunity, and meaningful participation in decision-making for all people. The way that this unfolds in practice is that social workers have active community involvement, participate in protest and social justice advocacy events. They use their platform and position to advocate for vulnerable populations, and they ensure that they are always advocating for their clients and the populations that they belong to. In regard to dignity and worth of the person, the NASW Code of Ethics states that social workers respect the inherent dignity and worth of the person. Social workers treat each person in a caring and respectful fashion, mindful of individual differences in cultural and ethnic diversity. Social workers promote clients' socially responsible self-determination. Social workers seek to enhance clients' capacity and opportunity to change and to address their own needs. Social workers are cognizant of their dual responsibility to clients and to the broader society. They seek to resolve conflicts between clients' interests and the broader society's interests in a socially responsible manner consistent with the values, ethical principles, and ethical standards of the profession. The way that this unfolds in practice is that it's very important for a healthy rapport to be established with clients. That way, clients feel like their dignity and worth of the person is being respected and supported. It is important for social workers to encourage and empower clients to the responsible self-determination and for them to be able to make their own choices responsibly and safely. In regard to importance of human relationships, the NASW Code of Ethics states that social workers recognize the central importance of human relationships. Social workers understand that relationships between and among people are an important vehicle for change. Social workers engage people as partners in the helping process. Social workers seek to strengthen relationships among people in a purposeful effort to promote, restore, maintain, and enhance the well-being of individuals, families, social groups, organizations, and communities. The way that this unfolds in practice is that it helps strengthen relationships. Whenever professionals are following this, it helps to strengthen relationships, and social workers need to have diverse understanding of different cultures and how relationships may function differently in different cultures. What might be viewed as a healthy relationship in one culture might be viewed as overstepping or boundary crossing in another. So it's very important that you understand the populations you're working with so that you can effectively help strengthen the relationships of the client with the people in their lives, as well as your professional relationship with the client. In regard to integrity, the NASW Code of Ethics states that social workers behave in a trustworthy manner. Social workers are continually aware of the profession's mission, values, ethical principles, and ethical standards and practice in a manner consistent with them. Social workers should take measures to care for themselves professionally and personally. Social workers act honestly and responsibly and promote ethical practices on the part of the organizations with which they are affiliated. The way that this unfolds in practice is that social workers must be honest, must uphold ethical responsibilities, and should follow the local laws at all times. It is important to communicate to clients when their confidentiality would be breached so that clients do not feel slighted if a social worker is required to report something that they were told by the client. And for instance, that would be if the social worker became aware that there was a risk of harm or a threat of harm to the client or somebody else. That confidentiality would need to be breached. And so being honest from the very beginning with the client of what those instances would be is very important for maintaining integrity and trust within social work, and especially within the working professional relationship between client and social worker. In regard to competence, the NASW Code of Ethics states that social workers practice within their areas of competence and develop and enhance their professional expertise. Social workers continually strive to increase their professional knowledge and skills and to apply them in practice. Social workers should aspire to contribute to the knowledge base of the profession. The way that this unfolds in practice is that social workers should ensure that they are competent to work with the individual client or population that they're attempting to work with. If they are not competent, they should refer that client out, and if they would like to become competent in the future in order to work with that individual or population, they should seek further education and or training. Additionally, social workers, as it's stated, should aspire to contribute to the knowledge base of the profession. Social workers should be lifelong learners who are constantly trying to learn more so that they can better serve, both the vulnerable populations as well as the greater community. When applying ethical standards to children and adolescents, social workers may experience a very complicated process. According to Hepworth et al., there are 4 primary ethical concerns, which are self-determination, informed consent, maintenance of client social worker boundaries, and confidentiality. Self-determination, social workers respect and according to the NASW, social workers respect and promote the right of the clients to self-determination and assist clients in their efforts to identify and clarify their goals. Social workers may limit clients' right to self-determination when, in their professional judgment, clients' actions or potential actions pose a serious, foreseeable, and imminent risk to themselves or others. So, minor children, they do also have the right to self-determination. However, it does become a bit more complicated when taking into consideration what might pose a threat to, that child or others, and that may be more situations than what we might deem would pose a threat to an adult. So informed consent is outlined in the NASW as requiring that the social workers use clear and understandable language to infer clients of the purpose of the services, risks related to the services, limits to services because of the requirements of a third-party payer, relevant costs, reasonable alternatives, clients' rights to refuse or withdraw consent, and the time frame covered by the consent. Social workers should provide clients with an opportunity to ask questions. Some of the implications for working with minors is that although child clients are not authorized to give consent for treatment, through the process of seeking assent, social workers can explain the proposed services to the child and seek his or her agreement for care. This is according to the Hepworth et al. Text. And so this does show that there is a little bit more complexity when working with kids, especially in regard to informed consent. And what the laws are in regard to children consenting. That does vary by state, and therefore in order to make sure that you are abiding by the expectations of social workers correctly, that you learn what the relevant local laws are so that you can ensure that you are following the laws while working with these minor clients. Maintenance of client social worker boundaries. According to our text, boundaries refer to clean lines of difference that are maintained between the social worker and the client in an effort to preserve the working relationship. They're intended to help prevent conflicts of interest, making the client's interest the primary focus and avoiding situations in which the social worker's professionalism is compromised. This is according to the Hepworth et al. Text, and this just emphasizes that the client-social work relationship is not a social one. In larger cities, this seems like it's something that's easier to maneuver, but when working in small towns or rural areas where there might not be very many social workers, there might end up being more overlap with an adult social worker maybe having, multiple roles in the life of that child, and therefore it would really need to be addressed on if it was appropriate to continue a professional relationship or if that client, the child client, would need to seek services elsewhere. Confidentiality involves just that everything that you talk with your social worker about is confidential and will not be released unless there is a threat of harm to yourself or others. However, when working with adolescents and children, there are, some additional implications. Minors are unable to consent in Texas specifically and various other states. Therefore, there are certain things that a social worker would be legally obligated to disclose to the client's parents. An example of this would be a 14-year-old telling the social worker that they're pregnant. In Texas, you are legally required to inform parents if their child has disclosed they're pregnant. While this does conflict with the ethical concern of confidentiality in social work, you must follow the law or risk malpractice. In this instance, you would be required to inform the parents, and the best practice would be to first inform the client that you are required to disclose this information with the client's parents prior to doing so.